Hello and welcome to another episode of Iranian Surgery podcast. In this episode, I'm going to get you through a short summary of facelift procedure. First, we need to know what facelift is. A facelift or rhytidectomy is a cosmetic surgical procedure to create a younger appearance in your face. The procedure can reduce the sagging or folds of skin on the cheeks and jawline and other changes in the shape of your face that occur with age. During a facelift, a flap of skin on each side of the face is pulled back and tissues below the skin are surgically altered to return the contour of the face to a more useful shape. Before the flap is sutured close, excess skin is removed. A neck lift or platysmoplasty is often done as part of a facelift to reduce fat deposits on sagging skin on the neck. Facelift surgery is divided into upper facelift, mid facelift, and lower facelift. Now let's hear a quick description of most used facelift techniques. Number 1 is upper facelift. An upper facelift, also known as a brow lift, is typically done on the area above the corners of the eyes. Patients who have sagging skin or moderate to severe wrinkles on the brow line or forehead tend to benefit best from this procedure. Number 2, mid facelift. The term mid-face describes the area from the corners of your eyes to the corners of your mouth, so this includes your nose, cheeks, and the area above your upper lip. Number 3, lower facelift. Finally, the lower face includes everything below the corners of your mouth. That would include the nasolabial folds or laugh lines and jawline. In many cases, a lower facelift addresses the area under the chin and the neck as well. Number 4, full facelift. A full facelift includes upper facelift and lower facelift. Facelift procedure gets done for a number of reasons, which we can point to some of the important ones like sagging appearance of your cheeks, excess skin at your lower jawlines, deepening of the fold of skin from the side of your nose to the corner of your mouth, sagging skin and excess fat in the neck if the procedure includes a neck lift. But you have to understand a facelift isn't a treatment for superficial wrinkles, sun damage, creases around the nose and upper lip, or irregularities in skin color. Now that we know when and why we need facelift, we're going to discuss how a facelift procedure gets performed. In general, a facelift involves elevating the skin and tightening the underlying tissues and muscles. Fat in the face and neck may be sculpted, removed, or redistributed. Facial skin is then redraped over the newly repositioned contours of the face. Excess skin is removed and the wound is stitched or taped closed. There are several approaches to facelift surgery. Your plastic surgeon will recommend an approach based on your goals and facial characteristics, including the shape of your face. The placement and length of incisions vary depending on the facelift technique that best suits you. Your surgeon might find you appropriate for a short scar facelift procedure, in which a short incision is usually limited to the area around the ear. Facelift surgery is usually done as an outpatient procedure. It may involve local anesthetics, sedatives, or general anesthesia. The procedure can take from 2 to 5 hours, and the person can normally go home on the same day after surgery. Most facelift techniques focus on the lower facial area, such as the jawline, jaws, and cheeks. A facelift can also focus on the mid-face or the forehead. In some techniques, deeper facial tissues may be repositioned or tightened to restore a more useful contour. In other techniques, removal or addition of fat or other soft tissue fillers may be necessary to achieve the best results. Today, many different techniques exist with outcomes that can be consistently reliable, safe, and durable. Your incisions will depend on the area of the face that is targeted and the amount of change you want. Once the incisions are made, various degrees of undermining of your skin is performed, and the deeper layers of your face are lifted. Undermining separates the overlying skin of the face and neck from the muscles and tissues deep to the skin. This frees or loosens facial and neck skin so it can be redraped at the end of the procedure, making sure skin is smooth. Then your surgeon will raise the skin from the temples, cheeks, and neck and lift and reposition the underlying connective tissue, removing excess fat and skin. If this procedure is performed in conjunction with a neck lift, the surgeon will draw the neck muscles together, stitching them together at the midline to form a strong sling of muscles that support the entire neck and jaw. Your surgeon may also include liposuction of the neck and jowls. Facial implants may be added to increase cheek or chin volume. Finally, your surgeon redrapes the skin over the new underlying structure and closes the incisions with stitches and/or small metal clips. Where needed, drainage tubes may be inserted. A padded supportive dressing is usually applied. The goal of your aesthetic plastic surgeon and the entire staff is to help you achieve the most beautiful and natural-looking results, and to make your surgical experience as easy and comfortable as possible. Regardless of the type of facelift you undergo, you will have incisions that involve the skin around your ear. In a traditional facelift, your surgeon will make incisions in your hairline at the temples, continuing down and around the front of your ears and hidden in the natural creases behind your ears in your lower hair-bearing scalp. In a limited incision facelift, your surgeon will make short incisions in your hairline, starting at your temples and continuing down and around the front of your ears, hidden in the natural creases. There may also be incisions in the lower eyelids, temporal area, or under the upper lip. In a neck lift, your surgeon will make incisions starting in front of your earlobes and continuing around behind your ears in your lower scalp. There will be a small incision underneath your chin. Facelift scars can be virtually invisible, narrow, flat, and well placed behind the ear so you can wear your hair close cropped. Your board-certified surgeon will place the incision in areas that are hidden and in areas where the scars look like natural wrinkles. Incision healing depends on the surgical technique, infection prevention, reduction of tension, your nutrition, any known or unknown underlying medical conditions, no smoking, and your genetic tendencies. There is a risk of hypertrophic scars and keloids anytime the skin is cut. This risk is greater in darker-skinned people such as blacks and Hispanics. Injections of a corticosteroid medication or other treatments might be used to improve scar appearance. Now that we have determined how facelift will get done, we are going to talk a bit about facelift aftercare and recovery. Your surgeon will discuss how long it will be before you can return to your normal level of activity and work. After surgery, you and your caregiver will receive detailed instructions about your post-surgical care, including information about drains if they have been placed, normal symptoms you will experience, potential signs of complications. Now let's go through some things you might experience immediately after your facelift surgery. You may be placed in a compression garment or wrap immediately after surgery. Wear this exactly as directed. Remove it only as directed for cleansing incisions or showering. To minimize swelling, recline rather than lie down. This will be more comfortable for you and can reduce swelling. Always keep your head elevated. Do not bend forward or over. You will have a mild to moderate amount of pain and discomfort. This should be easily controlled with oral medications. If it is not, call your surgeon. The discomfort and pain should begin to decrease within 48 hours after surgery. If you have a significant increase in pain after this period, call your plastic surgeon. Severe pain is rare. If you experience this, call the doctor immediately. Expect bruising and swelling. These symptoms will peak within the first 36 to 48 hours after surgery and will gradually subside over the next 10 to 14 days. To minimize swelling, sleep with your head elevated for a couple of weeks after the surgery. It is not unusual to have some slight drainage for the first 48 hours. A bulky cotton compression dressing with drains will cover your scalp and face for 1 to 2 days to help prevent blood collections under the skin. What is the recovery time frame after a facelift? Follow all post-surgery instructions, including information about bandages, drains, taking an antibiotic if prescribed, and the level of activity that is safe. Your doctor will let you know the signs of problems to watch for, such as signs of infection. Recovery time will vary by patient and in relation to the extent of your surgery. The first week. You may not dry for at least a week after surgery. A feeling of tightness in your neck is not unusual after surgery. This sensation is most pronounced in the first 1 to 2 days after surgery while the bulky dressing is in place. During your first post-op visit, the bulky dressing and usually the drains will be removed. You may be placed in a supportive elastic face garment that is to be worn according to your doctor's instructions. Do not take any aspirin or any anti-inflammatory compounds for 2 weeks before and 2 weeks after your surgery unless you first discuss it with your surgeon. It is recommended to sleep with your head elevated 40 degrees for 2 weeks. An additional pillow or 2 under your mattress may help, if necessary. Apply cool, not cold, compresses to your eyes. Do not apply ice or anything frozen directly on the skin. Soak soft washcloth or gauze squares in ice water and wring out well. Apply directly to the eyes, but not to the cheeks or neck. Do not apply any pressure. Apply cool compresses for no longer than 20-minute intervals. Do not apply heat. Stay up, sitting, standing, walking around as much as possible after you return home. This helps to decrease facial swelling. Avoid bending or lifting heavy things for 1 week. Besides aggravating swelling, this may raise your blood pressure and encourage bleeding. You may wash your hair gently 24 hours after your surgery. Do not use the usual heat type hair dryer. Use the cap type or use the cool setting on the blow dryer. You may shower or bathe the day after surgery, but do not let the spray directly strike your face. It is permissible to get your suture lines wet, however. Report any excessive bleeding that persists after applying pressure for 15 to 20 minutes. Although this was a short explanation on how to take care of yourself during the recovery, your medical team will give you a full guideline of what to do and when to do it. For more immediate information, you can check out our website, Iraniansurgery.com. At the end, let's discuss the advantages and disadvantages of facelift surgery. Here are the advantages of facelift. A facelift can improve many areas of the face in one surgery. It can last for 10 years or more and can make you appear 10 to 15 years younger. It can recontour the neck and jawline better than all other techniques. And what about disadvantages? A facelift will not create a new you, just a younger version of yourself. There will be some downtime associated with this procedure, and depending on your age and skin type, you may want a secondary procedure later on. These are the top 3 pros and cons to weigh when considering a facelift. If you want to focus on what is unique to you, please consult with your aesthetic plastic surgeon. Our goal here was to provide a short summary of facelift operation so our dear listeners can get a general idea about the operation. In order to get a more comprehensive take on this procedure, you can visit Iraniansurgery.com. Feel free to contact us for more information via WhatsApp or email. Hope you have enjoyed the podcast. Stay with us for more on Iraniansurgery.com.